At the last Regional Committee for the Western Pacific, member states overwhelmingly endorsed for the future a regional implementation plan for GPW13 as our shared commitment to prepare for the health challenges of a rapidly changing world. At the time, few would have predicted how soon and how intensely we would be challenged in the form of COVID-19. Since January, governments and people in our region have made unprecedented efforts and sacrifices to minimize the devastating consequences of this epidemic, save lives, and protect the vulnerable. We are grateful that today there is no large-scale community transmission in the Western Pacific. Each week, we have met with member states, sharing the latest on the virus and effective approaches to tackle it. Countries in the Western Pacific have been applying the very principle upon which our shared vision was built. For example, standing together in solidarity. Every country is important, from the biggest to the smallest, including the Pacific Island countries. Each country is sharing and learning from each other. Reaching the unreached, putting communities at the center and fostering homegrown solutions to minimize infection, care for the sick, and look out for the most vulnerable. And leveraging every part of the health system and every health worker. COVID-19 is an encounter with the future. We know others will come. This would include the health impact of climate change, surging rate of non-communicable diseases, and rapidly aging populations. Our regional vision for the future is more relevant than ever. So many people around the world have suffered from COVID-19. I think it is not just our responsibility to respond to this outbreak, but it is our obligation to make our societies and health system stronger and better prepared to face the challenges of tomorrow.